Hello Gemini, I am leah villegas, a first-year radiology technology student from Southwestern University, Pinma. I am here for a mock interview as our final exam in purposive communication. Please ask me 10 random questions about my understanding of radiologic technology, basic patient care, safety, and my motivation for choosing this career. I will do my best to answer honestly and clearly. After the interview, provide feedback on my performance by categorizing it into good points and points for improvement.
Well, Maria, welcome to this mock interview. It's great to see you're preparing for your final exam. So let's start with the basics. In your understanding, what is radiologic technology and what does a radiologic technologist do?
Radiologic technologies is to diagnose people and to capture images from the fractured bone or the lungs issues, and it is also called an eye of the medicine.
That's a good start. So, building on that, what specific techniques or equipment are commonly used in radiologic technology to capture these images? Could you tell me a little bit about that?
Can you please repeat the question?
Certainly. I was asking about what specific techniques or equipment are commonly used in radiologic technology to capture these images. For example, are there any specific machines or processes you've learned about?
X-ray, ultrasound, CT scan, and MRI.
Correct. Those are all important modalities. Now, let's talk about safety for a moment. What are some key precautions that radiologic technologists must take to protect themselves and patients during X-ray exams?
It is called ALARA, and ALARA is as low as reasonably achievable, and the ALARA have a three principles, which is time, distance, and shielding.
That's right. ALARA is crucial. Can you elaborate a bit more on those three principles of time, distance, and shielding?
Time is we need to minimize the time of exposure from the radiation, and distance is we need to distance from the exposure of the radiation to protect ourselves, and shielding is we need to wear PPE to protect ourselves from.
Exactly right. Minimizing time.
Next question, please.
All right, so can you explain the importance of patient communication and comfort in the field of radiologic technology? How does that play a role?
We need to explain to them the procedures of the X-ray imaging, and also we need to we need to make sure that they are safe and comfortable for the procedures.
Perfect. Making them feel comfortable and explaining the procedure is really important. Now, can you tell me about a time when you had to work with a team of healthcare professionals? What was your role in that team?
Can you please repeat the question?
Of course. I was asking if you could tell me about a time when you had to work with a team of healthcare professionals. What was your role in that team?
My role in my team is to X-ray and diagnose patients, and also I want to communicate with them with some medical forms and etc.
That sounds like a solid role, focusing on imaging and patient communication. Now, let's consider a challenge. How do you handle a situation where a patient is very anxious or fearful of the radiologic procedure? What would be your approach?
I will explain to them the procedures clearly, and also I want to make sure that they are safe and comfortable for the procedures that we must to do.
That sounds like a good approach. Being clear and reassuring is important. Now, finally, how do you stay up to date with the advancements in radiologic technology and changes in best practices? What resources do you use?
Can you please repeat the question?
Certainly. I was asking how you stay up to date with the advancements in radiologic technology and changes in best practices. What resources do you use?
Can you please repeat again the question so I can understand it clearly?
Of course, I was asking how you stay up to date with the advancements in radiologic technology and changes in best practices. What resources do you use?
The resources I use is
Yes, go on. I'm listening. What resources do you use?
can you again repeat the question?
Absolutely. I was asking about the resources you use to stay up to date with advancements in radiologic technology and changes in best practices. What resources do you use?
I will study hard to graduate this field, and I want to prove to other people and also my family that I can do more. And yes, thank you.
That's great to hear, Maria. You mentioned studying hard, but how exactly do you plan to keep your knowledge current after graduating? Are there any resources or methods you have in mind?
By reading books.
Okay, reading books is a good starting point. Are there any particular books or maybe journals or websites you find helpful? Perhaps some that specialize in radiologic technology?
The book of radiologic technology.
I see. Are there any particular authors or publications you find valuable?
I don't think so.
That's perfectly all right, Maria. It's good that you're utilizing textbooks. Well, that concludes our mock interview. Overall, you demonstrated a good understanding of the core concepts. I'll provide you with more specific feedback shortly. Thank you for your time.
Okay.
All right, Maria, as you wish. Thank you again for participating. I'll be sharing my feedback soon. Is there anything else I can help you with right now?
No, not at all.
All right. Have a great day, Maria. Good luck with your finals.
Can you please give me the feedback?
Certainly, Maria. First, here are some good points. You have a good understanding of the core concepts of radiologic technology, explained Alara clearly, and highlighted the importance of patient communication and comfort. You showed initiative in wanting to study hard and prove yourself. For points of improvement, try to be more concise in some answers, such as when describing resources. Also, mentioning specific resources to stay up to date would be beneficial. Do you have any questions about this feedback?
Not at all.
Great. Thanks again, Maria, and best of luck. Goodbye.
Thank you, Gemini.
You're very welcome, Maria. I hope you found the mock interview helpful. Don't hesitate to reach out if you have any more questions. Good luck with your finals.